still eating, but in the interest of time, we have about a half an hour program for you today, and we want to make sure that you have the benefit of the entire program. So, Mark, can you hear this? Can you hear in the back? It seems as though it's a little low. No?
Very good.
Yeah.
Yes, we can hear you.
We can hear you.
I'm Esther Gillies, President of the California Social Welfare Archives, and it's my privilege this afternoon to welcome all of you, Dean Flynn, the honored guests and special guests, and all of you who are here present today to our annual fall luncheon. Before we begin, I'd like to share just a few words about the California Social Welfare Archives. For nearly 30 years now, the social workers, librarians, archivists, and a broad cross-section of the community have worked with the CSWA to collect and preserve historically significant information, illuminating the emergence of social problems in California, as well as documenting answers that have emerged to cope with these identified problems. CSWA has also promoted the use of these historical materials by students, researchers, policymakers, and others. The oral history collections, of which we'll see an example in just a few minutes, include nearly 150 interviews with community leaders who've made significant contributions to the development of social welfare in California. Collections of papers from public and voluntary nonprofit social agencies making a significant contribution to California history are cataloged and maintained in the USC archival libraries. Some current examples of the exciting work that we're doing, and now exciting I use guardedly because you have to really be interested in history to see this as exciting, but the excitement is demonstrated in our recent acquisitions. We've recently added to the archives the Women at Work collection, papers of a nonprofit organization located in Pasadena, which for almost 30 years has provided assistance to women professionals, high school dropouts, single mothers, displaced homemakers, women from all walks of life in finding work. The Beverly Foundation, which has provided 30 years of service to seniors. The videotaped oral history of 5 women. It was a panel of 5 women, and it was moderated by our own Dick Thor, who were driving forces in the evolution of an info line in Los Angeles County from 1946 to the present. A really, really remarkable history. And in that video, the women describe the evolution of a program that originated right here in Los Angeles and has become a template for the development of social services information programs across the nation. In 2002, with the support of the USC School of Social Work, the CSWA created the California Social Work Hall of Distinction to honor social work leaders and pioneers in California social welfare and preserve their legacies for future generations. The CSWA today is creating connections between the past and the present, promoting learning from the past to inform understanding of contemporary and future problems and solutions. Very exciting place to be today. The CSWA is supported by interested parties in the community, the USC University Libraries, and by the USC School of Social Work, particularly the Hamovich Center. Dean Marilyn Flynn is here today to share some comments with us from the School of Social Work. Marilyn?
Well, I missed this part of the program. Let's see, let me get this. Can you hear me? Okay, good. It's been my great pleasure to spend most of my deanship watching the evolution of this organization. At the time I became dean approximately 12 years ago, The archives was underway to the extent that there were a number of interviews with important people. There was a sense of the necessity for having an archives. There were a large number of community volunteers involved, but the archives really didn't have a truly permanent place in the university. It had a connection, a strong connection to the library. It had a place to hold its materials in the library, but all the same, it didn't have a fully complete, a fully realized presence. Over the past 12 years, I've seen the leadership of this group mature. The archives have become a fully established and recognized part of the School of Social Work with continuing commitment for support by the school. And we have a very promising future ahead for this group as we move to digital media, as we move to new mechanisms for celebrating and retaining the history of this community. So I'm very, very pleased to welcome all of you here. I want to thank you for your presence and for your interest in the archives. I want you to know that, of course, we missed Frances's presence here very much today, since she was Frances Feldman's presence was such an important part of what we thought of when we thought of the social welfare archives. But we certainly will be continuing the archival presence in our own library, in our own school, and on this campus. I want to remind you that there are really only 2 social welfare archives in the United States. One of them is at the University of Minnesota, and one of them is here. And the special role for the archives here is really to build the history of the West. If you look at social work and social welfare, most of it historically has been written in terms of Eastern institutions, Western institutions, Eastern pioneers, not Western pioneers. So what the archives have to offer to the future is a view of what we have contributed to build that future. I think we have a big job ahead of us. I hope that we can keep this a fully energized and growing group, and I hope you will continue to attend these functions and to support this program. So thank you very much for coming today, and at this point, Esther, what do you want me to do? Thank you. And leave? Okay.
As Marilyn mentioned, Frances has been what I would call the pillar of the organization, but she was not a pillar. She was the 4 pillars, or maybe the whole foundation. Frances was so intricately involved in this organization that those of us on the board could not imagine having a luncheon without Frances present. So given that we are in archives and we have magical powers, we are bringing Frances to this luncheon because we know she's here in spirit, and we also know that I think Claude has told us she has the most information of any individual person in the archives, including a 2-volume, 1,000-page autobiography. But for our luncheon today, we have selected just a 4-minute segment of Frances, who will be here to talk about the CSWA.
Thomas Feldman, Professor Emeritus at the USC School of Social Work, which is where we are today. You have been involved with CSWA since its inception in 1979. How did it all start?
It started because George Nickel, who was a graduate of the school, I think in 1926, and had had many post-grad as a volunteer and a professional, began to worry about the fact that people he knew who had really a great deal of knowledge of social welfare in California, but they weren't able to fall. And he kept worrying about the knowledge that had existed before. He talked to my husband about it in 1955. I know that because that's the year my husband died. It was the last thing they talked about how could we preserve the records of agencies, some of which were going out of business, and the memories of people who'd been involved in social welfare. And it took 7 years after that, just talking about it, and then he established a small committee, and it began. So he was the one who started it, and he was as president for a number of years.
And what has your role been since it started?
Well, kind of a nagger and a helper, and help to decide what policies we ought to develop to recruit people. He found the initial group of people, and then we added to them.
And what about CSWA? How do you see its future?
Well, I think it has a good future because there's still a lot of people to be interviewed. And more agencies are beginning to recognize the fact that they can't just hold on to their materials in some dusty box off the corner, and they need the space, and it would be good to let scholars see what there is. But that's a slow process, but I think we're moving in the right direction.
That seems to be optimist.
I'm an optimist.
And it's contagious.
I hope so. Well, in 94 years, so much happens.
Consistent with our mission to bring the past to the present and plan for the future, our keynote speaker today, Dr. Areta Crowell, will be speaking about mental health in Los Angeles County. Dr. Areta Crowell has been involved in California's mental health system for more than 40 years, working both with the public policy and service delivery arenas. She has served in the State of California Department of Health Services and as the Director of San Diego County Mental Health Services. She also was the Director of the Los Angeles County Department of Mental Health, where she was responsible for 1,300 employees, contracted with more than 100 local provider agencies, and oversaw an annual operating budget of $474 million. Dr. Crowell is with us today to present mental health programs, public mental health programs in LA County, the past, the present, and the future. Dr. Crowell?
Get this up where I can speak and see at the same time. Is that close enough? Hello, it's good to be here with all of you today, especially on a day when we honor the lives of two icons of our history, even as we mourn their deaths. very special friends and colleagues who've made such significant contributions to the public mental health services of Los Angeles. Both Dr. Jim Carles and Dr. Frances Feldman I had lots of contacts with both of them over the years and appreciated and enjoyed both of them so very much. When I retired from Los Angeles County in 1998, more than 10 years ago, yay, I thought that a useful Millennium Project would be to write a 40-year history of the department. It has started in 1960, so 2000 would be a 40-year history. That would be a good thing to do. I imagine that I was inspired by Frances, although I didn't actually think about it that way until more recently. But I had been coming to Social Welfare Archives meetings and was aware of that interest and concern, and I shared exactly that same thought. Get the ideas of people before they are gone. Get their memories and their ideas of the history. So this volume resulted. Dr. Marv Southard, the director of the Department of Mental Health who succeeded me, was delightfully willing to let staff work on this project. Otherwise, it would never have happened because I certainly didn't have the technical know-how. But I did a lot of the work of getting people together and getting them to write things. And so I'm going to pass this around so you can take a look at it. Look at the index. You'll probably find people you know as you look through it. This is a very informal history. We tried to capture people's ideas, their memories, their thoughts, some of them funny, some of them not so funny, and put some of the key historic documents in there so it's all together. And you can really get a sense of what's going on in Los Angeles County, I think, if you look through this. So I'm going to pass this around, and incidentally, it is in the archives. So if you take a look and then just pass it on to the other tables while I speak. I have to tell you, my eyes are going, and it's going to be hard for me to both see and speak, so forgive me. Obviously, the past of public mental health goes far before the Department of Mental Health, and yet I think I was asked, because of writing the history book, to really concentrate on the Department of Mental Health history. But what goes before? Obviously, the state hospitals, the Bureau of Social Work, where Jim Carles worked. That later became the Office of Mental Health Social Services. That was Community Mental Health in Action long before a Department of Mental Health was even envisioned. There were child guidance clinics, like the Los Angeles Child Guidance Clinic, which is so close to USC here and has a strong connection with USC. That was started in 1923. So we had public mental health services. Probably the most prominent in the community were the county hospitals, and they had outpatient psychiatry clinics, and Big County had the inpatient program. The past of public mental health owes a lot to Frances Feldman. The department was started as a result of the passage in 1957 of the Short-Doyle Act. And Frances and her husband and her brother, Dr. Jack Lomas, were active in getting that law passed. And then they were active in getting a department established here in Los Angeles County, because the Short-Doyle Act was voluntary. Nobody required a county to have a mental health program. All that was required was state hospitals. A lot of counties did not act on that until they were required to in 1969 in the passage of LPS. But Frances was one of those who wanted to see it happen in Los Angeles and went to work as Frances could. You will find some of her thoughts about this, and because of the history, I want to read from her thoughts that are in the book. It's on page 31 for anybody who has it. One of her first tasks was to do speaking. She was talking to the Pasadena Women's Civic Club, and this would be 1958-59, to explain the importance of a Short-Doyle program in Los Angeles County. Early in the session, a woman rose to protest that such a department would make it possible for mental health people to come to a citizen's home in the dead of night and transport him to the wilds of Alaska, much in the fashion of communists in Russia. After all, everyone knows that psychiatrists are communists. Why Alaska? Well, it happened that Alaska was then a United States territory, and Congress had under consideration a bill to fund the establishment of a neuropsychiatric institute in Anchorage. Why communism? Well, there had been many hearings going on in the community where there had been a lot of effort to identify people with communism. Quote, "Momentarily I was taken aback by this outburst and the affirmative nodding of heads accompanying it. Now I recognize some of the women from hearings held by the City Council or the Board of Supervisors, where they identified themselves as minute women and spewed vitriol about fluoridation and other issues. Among my teaching areas was the development of health and welfare policy in the United States. So I now asked if the audience knew of Benjamin Rush, signer of the Constitution. Oh, yes, they chanted. Did they know he was an early psychiatrist, often called the father of American psychiatry, and had worked closely with Benjamin Franklin in separating the mentally ill from people imprisoned for crime? I forbade mentioning that he was a believer in the use of leeches. While I am dubious that some of these ladies were converted to the cause of mental health, I was permitted to present my views without further similar outbursts, and the questions of some led me to believe they truly had listened." So there's our Frances at work. I was interested to see just now in the USC social work history book that is at our tables, which is a very impressive, much more glamorous and new age than our county publication. But I noticed there the emphasis on the McCarthy era and the role of the anti-communists in our whole social policy, and it was the same thing happening. Well, anyway, finally, Los Angeles did authorize the establishment of a mental health department. They started off by authorizing a mental health advisory board quite a while before they actually met. They met in 1959, and once again, these same connections, Dr. Jack Lomas chaired the advisory board. He did so for 12 years, so he was still chair when I came to the department in 1966. So they created a department. The question then was, would it be part of the Department of Charities, which ran the big county hospital, or would it be a separate department? It was created as a separate department to keep an eye on those very suspicious people, because they were all not sure what this mental health thing was all about. They had a lot of questions. It actually passed on a 3-to-1 vote. Any of you who watch the Board of Supervisors know that's not an auspicious beginning. And Dr. Brickman, who was the first director, Dr. Harry Brickman, was always aware that he had been taught you have to go into an issue knowing whether you can get your 3 votes before you bring it to the board, because if you can't, you're in deep trouble. So at the time the department was established, there were outpatient services at Olive View, Harbor, and the Medical Center. There were alcohol treatment services at Acton and Warm Springs for men. There was a mental health department at the Superior Court, which certified people for commitment to the state hospitals. That's all there was. So what was the department going to do? Let me read what Dr. Brickman said about his goals for the department, and this is quoting from 1965. 6,000 Los Angeles residents were admitted to state hospitals in 1964. Can you imagine that? Think of our population, which was about 5 or 6 million. We don't have anything like those numbers in treatment even today. A network of regional clinics was planned to dramatically reduce that number. We hope to develop our program to the point where no county resident will require state hospitalization, and we should be able to do it for less money, said Dr. Brickman in February 1965. Our main goal is to reduce the development of chronic disability. In the intervening time between the founding of the department and that quote, the department had grown to 12 locations, 30 services, and a budget of $6.5 million, of which the state provided $4 million. You just heard that when I retired, the county budget was nearly $500 million. Today, the annual county budget, any of you guess? $1.5 billion. That includes money we'll be talking about later. Cost of living and increase of services. We are still very aware of what we can't do that we know we ought to do, even with that money, but think how little it was. Programs were started very gradually in the 60s to get enough money from the Board of Supervisors. I remember speaking to a group in New York as they were planning community services, and that was in 1969, and they couldn't believe how few services we had at that time. Community services in California were late in development. In the interest of time, I'm just going to go through a few quick highlights. The 60s saw the development of clinics. One of the most notable was the East Los Angeles Mental Health Clinic. Margarita Mendez, who's in your book and in the Hall of Fame, and Armando Morales were social workers who worked with Dr. Marv Carno to prove that Hispanic people would come to use community mental health services if they were culturally competent. We didn't use those words in those days, but that's what that clinic was, and it demonstrated it. It put to rest national myths about whether there was an incidence of mental illness in the Hispanic population that was comparable to other populations and what kinds of services they needed. That was a landmark program. In 1963, the Federal Community Mental Health Center Act was passed. Implementation of that in Los Angeles was, like almost everything else, somewhat controversial. The law called for catchment areas to meet a certain population requirement. There would have been 55 catchment areas in Los Angeles County, and the idea was that you would have comprehensive, complete services from inpatient to outpatient to consultation and everything else for all ages. We did a calculation of what it would cost to implement a sample program like that across Los Angeles County and concluded that it would be many, many more times than we could project, even more than we could project today. So the county applied to get federal money for community mental health centers on a combined catchment basis that would correspond to the usual health planning districts in the county. The federal government, through their Region 9 representatives, refused. So it then came up to local nonprofit agencies to apply for to get federal community mental health center funds. Only a few actually did that. Meanwhile, in Northern California, the Bay Area counties jumped on that bandwagon, and every one of them applied for and got federal money to start community mental health centers at the rate that they called for in the federal legislation. That established a disparity of funding between the North and the South, which exists to this day. I finally, at one point in my career in the department, said, well, what are we going to do? Let's try getting federal money. We'll just say we're going to serve one catchment area. So what are they going to do? And we actually started 3 more community mental health centers under county auspices with that kind of approach. So that helped a little bit. We put one of them in San Gabriel, which had been very underfunded relatively, and again remains relatively underfunded in terms of population need. Once you get started on an inequitable distribution of resources, it's very hard to make any adjustment. The 60s were also a time for social workers to remember that that was the time of the MD-ities. No one but an MD could become a mental health director. The social workers in our clinics used to complain that they'd get in new psychiatrists, young psychiatrists, who had no training in dealing with the county population, and they had to train them up. They got pretty resentful of that. 1969, the huge change came with the passage of Lanterman-Petra's Short, and with it, the limitations on involuntary commitment. It was intended as a correction for far too easy involuntary commitment, which had been the case before. It was also modeled on the successes of the county hospital in seeing people before they went to the hospital and diverting them to other services. And they thought that by putting the counties required to do a screening before the person could go to the state hospital, that they would have that effect. They would be able to do the diversion. And that's reflected in what Dr. Brickman said in '65. Now, this law wasn't passed, wasn't effective until '69. The other thing that happened at about that time was Department of Mental Health was merged into the Department of Health Services, which had been the Department of Hospitals before that, and several health-related activities were merged into one department. It was another time of controversy. Mental health people didn't want to be merged, and as it turned out, it didn't work very well for mental health. We were, at that time, funded with state allocations on an annual basis. What you didn't spend went back to the state. And what we found was that because of unilateral across-the-board administrative actions taken by the Department of Health Services, vacancies weren't filled and other authorized activities couldn't be implemented. So we were returning money, which we all considered pretty disastrous when we knew how much unmet need there was in the community. Liz Witherell, who was the director of that combined department, and I remain friends and colleagues, and we laughed together, and his quote in the history book says, mental health represented only 10% of the operation in terms of personnel and money, but we were 35% of his problems. Well, we finally got enough protests from the Mental Health Advisory Board. The Advisory Board said, no, we're not going to be neglected like this. And they finally they refused to pass the county plan. And that created a crisis with the Board of Supervisors, which led to the separation of a separate department. During the years of merger and the frustration led to the resignation of Dr. Brickman, Dr. Herb Robinson, Dr. Hal Maveritt were interim directors, but the DHS was not appointing anyone on a permanent basis. So all of those things contributed to the unrest in the mental health community, calling for a separation again. And that department was reestablished in 1984, and Dr. Richard Elpers became that director at that time and stayed until 78 to 84. Get my dates right here. That effort to merge mental health into health services has not gone away. It has been raised several times in the intermediate years, and I expect it will happen again. There are reasons. It was a very appealing argument in the first place. After all, we do know that mental health is part of health. It's fundamental to health, and therefore we should be able to treat people as whole people and do this together. But frankly, nobody has yet found a very good way to make that happen. And we are struggling all around California, around the country, people trying very hard to make it happen. Administrative merger is not necessarily the way to go. So I would urge great caution the next time that one comes up. We move on then to the 70s. State hospital closures began. The first, Modesto, was closed in 1970, DeWitt in 72. Budget problems began then, and they have been never-ending. I remember my disillusionment when the state director of then mental hygiene told us that we shouldn't worry about our county budgets because we were getting an increase in dollars. That at a time when the cost of living was really quite high, and the increase of dollars represented maybe 1%. So it was a net loss. Bureaucratic doublespeak was my first dose of it, and of course we never have seen the end. Prop 13 passed in 1978. That led to more problems for local government. We had been suffering from underfunding and cutbacks through the 70s. Governor Jerry Brown had agreed to an infusion of new money to try to make that up. If you look in the archives, you'll find a book called Old Problems, New Directions, which tried to define what we needed to do to meet the needs in the state. But that promised infusion died when Prop 13 passed. The 70s marked the early beginnings of seeing homeless, mentally ill persons on our streets. Family members complained that the system did not pay enough attention to their problems, that the system was too attentive to persons with less serious illnesses. Course correction was needed. Parents such as our late beloved Don and Peggy Richardson and Stella March, who is still a vital, lively force in the community, worked to refocus attention on persons with serious mental illness. They also taught the professionals about the significance of substance use on persons with serious mental illness. And that led to a lot of efforts to redesign the system to be more effective for such persons. In the first years, it was, you're going to get mental health service here, you'll get substance abuse service here. That didn't work. We're still struggling to meet the challenge of making a program that really works across the board. I worked at it. Dr. Southard has worked at it. Persons with co-occurring disorders remain a challenge, not the least of it because of the bureaucratic separation of funding, and that goes all the way up to the federal government. 1980s, we developed a California model with Los Angeles leadership to try to define unmet need because the state couldn't acknowledge that there was unmet need. One of the interesting things, I'm going to say that first social worker to become a mental health director in Los Angeles County, Roberto Quiroz, took over in 1984 and was director until 1991. 1986, there was a plane crash over the city of Cerritos, and mental health launched a disaster assistance response at that time. That was the first of an ongoing series of work for the county and all of our agencies to provide disaster assistance. We got very good at it after the Northridge earthquake, and I talked to one of the disaster coordinators for the county this morning who said, you know, because of all the structural damage after that earthquake, they haven't quite finished resolving the problems with FEMA. There are 3 buildings that they're still working on. Can you imagine that many years later? We got to be good at it. But one of the most touching things in the history book was written by Supervisor Don Kenobi, and it's in his foreword. He was a mayor of Cerritos when that plane crashed, and he was busy working on disaster, assisting the community, doing things. But the mental health people taught him what could be expected and what would be needed. And he acknowledges that it wasn't long before he started to recognize in himself the trauma response symptoms, and he went and talked to the mental health people himself. He learned about mental health and that's one reason why he has been a consistent champion of mental health in the county ever since. But it's a beautiful testimony from him. We had the passage of the Children's System of Care Act and a lot of improvement of our children's services in the county, inspired by Dr. Rose Jenkins. And then we had Lieutenant Governor Leo McCarthy led an effort to help this state figure out how to put into practice what had been learned across the country of how to deal with persons with serious mental illness, how to really provide effective services. And out of that, we passed the Adult System of Care Act, AB 3777, with our legislative hero, Bruce Bronson, who did an awful lot for mental health while he was a state legislator. Out of that legislation came pilot program money, which went to what became the Village in Long Beach, which was sponsored by the Mental Health Association. And that Village model put into practice what we had all learned but hadn't all done, which was to know that what people with serious mental illness needed was flexible, wrap around, whatever it takes kind of approach that recognized that they would need help with housing and jobs and social support and everything that goes up to make a normal life. And that's what they did at the Village. The next major step came in 1991, a year of state fiscal crisis. Governor Pete Wilson, and you may have seen this recollected in the press in recent months, he committed political suicide by supporting a state sales tax which was partly directed to finance mental health services. And that led to the passage of realignment legislation in 1991. It was a very complex financial and programmatic governance reform of California's mental health and human services. It permitted for the first time a county to shift money from state hospitals into the county-managed community service network. That was a very profound change. Let me illustrate that. Before that happened, the county had a budget, but part of it was directed to its state hospital utilization, and the county had no control over how many dollars went into that pot. So as we in Los Angeles had most of the state hospital beds in the state, we had over 1,000. Those costs went up. The county had to pay for it. It had a fixed allocation. So what happened? The community services had to be cut. There was no choice. Now, I went to San Diego in those years, part of the demoralized group of people who were saying, what are we going to do? This is not working. We are not able to implement what we know in community mental health because of the way the budget is structured. Realignment changed that so that I was willing to come back and put forth a plan that was supported by the community to cut our state hospital utilization and substitute those monies for wraparound programs modeled on the village. We could cut the state hospital by 100 beds and serve 400 more people, 500 people in the community. And we could do it with absolutely the right kind of wraparound services that we knew would be effective. How did I have the guts to do that? Well, partly because San Diego had existed with 73 state hospital beds, while we had over 1,000. San Diego is 1/4 to 1/3 the population of Los Angeles. You do the math. I knew we could do it if we had these right programs. In fact, that was the way to move us into what would become the model for today, and that has happened. So the success of the replica of the village led to the passage of AB 34 and AB 2034, which infused more money, and because LA had done this much, they were able to implement those augmentations quickly and prove that they were effective, and that was the basis for the passage of Prop 63, the Mental Health Services Act. That was the foundation of data that was needed, but thank goodness for realignment. And then, thank goodness for the Mental Health Services Act. Now, I'm going to just quickly, as we talk about today and tomorrow, that is so tied into the Mental Health Services Act. If you don't know what's happening in that, I urge you to go to the Department of Mental Health website or the State Department of Mental Health website, and there's lots and lots of information. An unprecedented thousands of people have been involved in working with the department to identify the unmet needs in this community, to identify the unserved and underserved populations, and particularly the racial ethnic members of our community who have often been totally ignored in planning and program development, not intentionally, but just as a byproduct of our limited resources. The Act is complex. It is intended to transform county services into systems focused on recovery and resilience with whatever it takes approach to provide goal-directed services to consumers and their families. At the same time, it provides for elements of a comprehensive mental health response for the community, which has long been ignored because of our financing problems. It includes prevention and early intervention, which is now much more sophisticated than it was when we talked about it in the 1960s. A lot of it by virtue of learning from other countries which have put into play large-scale public health efforts to identify on an early way persons with mental illness and to reduce the incidence of mental illness accordingly. There will be targeted stigma reduction efforts and funding for other elements also left out, like the human resource to meet the demands that we need to serve so many more people that this act will make possible, as well as to serve so many different kinds of services. It includes money for housing, which we know is essential to get homeless people off the streets. Other capital and technological support, such as state-of-the-art technology and medical records and prescription management and so on. So what's happened in LA so far? As I told you, the county budget right now in mental health on an annual basis is about $1.5 billion. $1.5 billion comes from the Mental Health Services Act. But there are a lot of functions that are still required that are not covered by the specialized targeted funding uses specified in the Mental Health Services Act. So while this money is designed to really leverage the existing monies to make a transformation so that the programs will in all be more effective in reducing the incidence and prevalence, the seriousness, and the impact in terms of lost lives of mental illness. We have 1,500 children now in full-service partnerships in Los Angeles County, about 1,100 in transitional age youth, that's young people between 18 and 25, which largely deals with the kids who've come out of the foster care system or been in probation and don't have community support systems to keep them going. We have 3,300 adults in these services and 300 and some older adults. We have 1,389 served in field-capable clinical services, which are outreach, but in between typical outpatient programs and the full-service partnerships. And one of the biggest changes is we have 6,100 clients who are being served through client-run peer support and wellness centers. This is a big change in philosophy and approach. Our clients often felt devalued by mental health professionals. Frankly, some of our mental health professionals were the most stigmatizing people you could ever encounter because they would not see the hope and the need and the opportunity for recovery for persons they were serving. Clients have shown that they can connect better, and they help themselves as they help someone else. So it's a win-win situation. Big change, and something I am very proud of. We had a lead in that in LA, starting Project Return in the 80s. And we've had some wonderful client leaders who have made international and national reputations come out of Los Angeles. Some of you will have heard of Pearl Johnson or Bill Compton, iconic figures in the client movement. We've had a lot of money come in for training and workforce development, information technology, capital facilities, housing. Prevention and early intervention is going to be allocated $131 million. It's really quite astounding. I believe that the mental health services intent to transform the system by leveraging these new monies is working. I see the breadth of knowledge of new ideas and the eager adoption of new ideas by all stakeholders. The energy across the planning and implementation efforts is remarkable. As I wrote in the dedication to the history, Los Angeles has always been best served when the people who have needed mental health assistance, their families and friends, and those who have worked tirelessly to make culturally appropriate and effective services work together to overcome frightening ignorance, deadening stigma, and crushingly inadequate funding. I think we are seeing that at its best right now, and the future of Los Angeles County is nothing but the best that I think it has ever been. And I encourage you to get to know what's going on if you don't already, and take a hand, because your history, your knowledge is so vital to making this all work. Thank you.
And now to our honored guests today, those who are receiving the George Nickel Award, the highest award given by goes to Mrs. Ann Thor. Just a brief word about Ann. Ann has been a volunteer for more than 50 years, serving her community, serving her church, focusing on the needs of children and youth. and in particular, supporting the needs of the School of Social Work. Anne has been the wife of Dick Thor for more than 50 years, is a mother, grandmother, and a great-grandmother, and exemplifies what it means to give of oneself in the service of others. Thank you so much, and congratulations, Anne.
More?
We need one more?
Yeah, sure.
Picture done.
That's good.
And congratulations to Anne, who is a wonderful member of our Board of Counselors for the School of Social Work, and together with her husband has named a professorship in our school and has made an enormous contribution. It's my pleasure to say a few words about Frances Wu. She's really a monument to what can be achieved by a woman with vision and social commitment and a keen mind. She was a native of mainland China and told me that she moved into a dormitory when she was in 5th grade, where she remained, really, until her graduation from college. And so she understands group living, she told me, and that this accounts for a great deal of her subsequent work. She came first to Canada, where she graduated with her master's degree from McGill University, and then to New York City, where she was actually in child welfare, working in various agencies for about 15 years. She got into her car one day and drove all the way across the United States on her own to arrive just before registration, fall semester, to get her PhD, and the only person in the School of Social Work building at that particular hour was Frances Feldman. Frances Feldman and Frances Wu met. Frances Feldman became her advisor, her PhD chair, and subsequently her lifetime mentor and advisor and close friend. Frances Wu's interest was in gerontology, but she settled for social work because there was no PhD in gerontology at that time. She, at USC, with her doctorate, she became the first Chinese-American woman to receive a doctorate from the University of Southern California, the first in our school, and through the Golden Age Association, the first to endow a chair in Chinese-American elderly in the United States. Her real interest, as I mentioned, was in the elderly, but how does group living translate in the 70s? Well, that translates into senior housing, and my favorite part of Frances's life is that she convinced HUD, the most bureaucratic of all agencies, Department of Housing and Urban Development, to build a facility for Chinese elderly that has koi ponds, that has Chinese roofs. When they said that they would not finance koi ponds, she said that's how Chinese get their exercise. They watch the koi swim. So instead of a gym, they got a koi pond. She never said yes to anything she didn't want, and she, as a result, created a center for elderly persons that has been visited by people not only all over this country but from all over the world. There's several very good comments about her and the awards that she's received, and I just wanted you to get a small sense of who she is as a person. She's a real estate developer, is she not? A very successful one. She's a board president. She became a representative of the Golden Age Association to the government and to the community. and a fierce advocate for the 250 families who lived in Golden Age Village. She also planted roses and vegetables and anything else that's beautiful that grows. And this is what people come for from all over the world, is to have some of those roses and vegetables. They're excellent this time of year. She's famous. She's known both here and in China. She's famous for what she has done for older persons. I want to, Frances, at this time, would you come up? It's our great honor to present her with the George D. Nickel Award for Outstanding Professional Services.
I want to thank you all for participating today. I want to particularly thank Dean Marilyn Flynn for her wonderful remarks today. The Board of Directors of the California Social Welfare Archives, if you just wave your hand so we can see who you are. Most of the board is here today. Very hard-working, wonderful board. To Marlene Wagner and her staff. Marlene is unavailable today, had to be out of town, but particularly to Latasha Young, who has worked so hard and so diligently to put this event together for us. And I want to thank all of you for your participation today and kind of alert you to the fact that I am taking to heart Frances's approach to life. Bug, bug, bug. So you may be receiving some bugging from us to encourage you to remain involved with us and participate in this journey back into history as we use the information and the history of our profession to support our future in social welfare. So thank you very much, and we will see you again at our next event. Thank you.